I'll give a little bit of an explanation as to where I've come from, what I do, and how this relates to Metaverse in healthcare. So I was formerly the NHS England delivery lead for the extended reality programme in the National Healthcare Service. That involved looking at the infrastructure. So how do we test this type of technology in the NHS? How do we check if it's safe, if it's effective? And that really involved things like the strategy development around testing the technology, generating the evidence, so working with specific sites across massive NHS across the country, establishing a community of practice to start sharing some of that knowledge and best practice as to where things were working, where things were not working, and also looking for a clear route to market. And some of this I'll talk through in the next couple of slides. I have since moved to a more kind of local area around UCL Partners, and that really covers around 5 to 6 million people from the North London to the Essex coastline. And we're really focusing around these 8 priority areas, and that spans all types of digital health tech. However, my kind of mission within UCL Partners is to really explore immersive, particularly initially around the mental health space. So if anyone was around for the panel before, some of the jargon that was talked about. What is the metaverse? There are so many articles online. However, there is no agreed definition. It doesn't exist. And despite what any companies or social media blogs say, it hasn't been created yet. Not by anyone, not anywhere. However, it's a concept that's talked about a lot. And there are some common themes that are coming up around what we think the metaverse will be. So that idea of persistence, a massive ongoing experience, multiple worlds, a network of worlds, all of these engaging together, the idea of different types of presence, so moving from us interacting with an interface to actually feeling like we're within an experience, whether it's ourselves alone or alongside others and feeling the presence of others as well. There is a lot of information out there around the economic growth that it's going to unlock. In the same way that it happened with the commercialization of the internet, it's a very similar principle that's talked about with the metaverse as well. The idea around multiple contributors, I think that's happening now. You know, there's a lot of people that are inputting into the internet at the moment, and how that's going to change is something that's talked about in all sorts of ways. And then there are 2 sort of other themes that come out around interoperability and around decentralization. And initially, there was quite strong opinions around how far this might stretch with the metaverse. And actually now we're starting to see some debate around how interoperable the metaverse really will be. How is it going to interact? And in terms of decentralization, how is it going to work, especially with some of the big companies out there at the moment doing a lot of things in the quote-unquote metaverse? And so I guess despite whichever way we think of it, however we want to define it, there is some general kind of consistency in agreeing the types of technology that we think will be leveraged to enable this metaverse to come about. Things that you heard talked about hopefully throughout the day. So Web3, AI, blockchain, connectivity, computing, there's no doubt many more as well. And all of these have the potential to impact healthcare, either individually or together. Now, most of the efforts within healthcare have been looking at these types of technology individually, maybe not including connectivity and computing, which kind of underpins a lot of the tech within healthcare. What I'm going to talk about today in a little bit more detail is around the immersive tech space. So I can't do a talk on healthcare without mentioning the pandemic and the impact that it has had in accelerating the acceptance of digital health tech. And so naturally, as the pandemic rolled out and impacted on people around the world, one of the things that we saw within the NHS was people turning to digital health tech. The common ones that maybe have been talked about online, so remote technologies, caring for yourself at home. However, one of the more interesting ones, which was always off the radar for the NHS, was immersive tech. And we saw that providers started to look to this type of technology to provide unique things and address specific challenges. So, for example, around the PPE kind of challenges, there was a massive supply-demand issue. And so what we saw one of the trusts at Imperial College do is use mixed reality headsets to actually allow streaming, live video streaming during ward assessments of patients, which meant that actually there was less of a need for people to be there in the ward and therefore less of a need to use PPE. Another example is in Staffordshire, where they use virtual reality to provide lung rehabilitation. Not only did that kind of hit the waiting lists that were building around that area, but also there was a demonstrable impact in terms of the improvement that patients saw, and they could receive this kind of treatment in their own home setting, which was really important during the lockdown phase. So the past couple of years, we've done a lot of work to really understand this trend. Where is it being used? How is it being used? What are those benefits? What does the evidence look like? How do you actually deploy something like this within the NHS? And what's needed to really make it work? What we found was that there were a couple of applications initially where it was a lot more prevalent. So I'm talking about things like assisted reality, virtual reality, augmented reality as well. The top one being education and training. Now, that isn't a surprise. Anyone who's recently been through university might have experienced simulated learning. And so this type of technology is being embedded within the higher education institutes. Other areas, mental health and wellbeing, physiotherapy and rehabilitation, like the example I gave with Staffordshire earlier as well. And then some kind of natural applications as a result of the pandemic. So things like remote collaborations, whether it's within the UK or internationally to gain international experience as well. And then some kind of trials around visualizing data, particularly around image-guided surgery. That's something that keeps cropping up. I haven't seen anyone quite do it well just yet, but it's something that the NHS is definitely experimenting with. In terms of the benefits, they tend to be pretty familiar across a lot of these applications. The impact on how the NHS operates, the staff time, the efficiency of services, the experience of staff, because some of those frustrations are ironed out with this technology. For patients in particular, increasing accessibility, so other options to receive treatment and care, and then the impact that that then has on the patients in terms of their own outcomes as well. Some of the barriers, a lot of this, to this crowd, I'm assuming is not going to be a surprise. So the biggest one being the lack of evidence. I mean, immersive tech has been around for decades, and the evidence on PubMed, even if you do a quick search, is pretty poor. However, we're seeing we're seeing improvements in terms of the robustness of the data that's coming through as a result of this research. Other barriers include high costs, route to market. Healthcare is notorious for being difficult to penetrate for any type of digital health tech. Over the pandemic, rules were lowered. It became a little bit easier. People were a little bit more forgiving if there wasn't as much evidence, if it could do what needed to be done at a time when it was necessary. And so those success factors around infrastructure, so having an organisation that has already dabbled in XR and knows how to use it, how to clean it, particularly in times of the pandemic, became really important. Starting to generate that evidence for patient outcomes as well. So, given what I mentioned around the evidence, one of the things that we kept hearing is, if this is going to be so big, how can we really show that these are the application areas, these are the benefits that we can achieve, and this is the really good evidence that we can have to show that it has value in the NHS. And so what we did was we pumped 2 million into the NHS to specifically look at how it could be applied. So this covered the whole extended reality spectrum, right from assisted through to virtual reality, across lots of different application areas that you can see there. A lot of this work is due to be published, but Generally, early findings, they all show the benefits that we talked about earlier. So reduced costs as a result of treating people in different ways, improved staff satisfaction, improved patient satisfaction, a real impact in how long people are in hospitals, in people being able to access care as well. And as a result of some of this work, we've also really encouraged some of our trusts to start sharing when it has worked well, why does it work well? So developing a blueprint that others can then use to adopt this type of technology in similar ways. So Torbay Hospital is a great example. It's been dabbling in extended reality, immersive tech for about 10 years. It's done a lot of work around pain distraction, a lot of work around remote consultation, particularly around breast cancer as well. And they've demonstrated their benefits, saving around £40,000 a year by using this technology. However, there have been changes in how people are using immersive technology within the healthcare space. So before the pandemic, you could probably count on two hands how many organisations were using this type of tech. It tended to be specific pockets around the country. The pandemic accelerated that massively. So there was almost a 13 times increase in the number of organisations that started using extended reality. And that was a result of the way that it was being used, the benefits that were being seen, and how this information was being shared between the organisations within the NHS as well. Post-pandemic, it's starting to change. People are starting to go back to old processes. Red tape is coming back into play, and so we're seeing changes in terms of where XR is being, where immersive technology is being applied, but also around the factors that are affecting implementation and successful adoption of this type of technology in healthcare. So whereas before there was a lot of immersive tech being used across education and training, it's still in the top 3. But actually what we're seeing is that there's a lot more suppliers now coming in, trying to enter into the NHS with mental health and wellbeing applications, with physiotherapy and rehabilitation solutions as well. So in Leeds, there's some really cool videos out there around people using augmented reality with Parkinson's patients, so they can actually see lines. And we've heard from patients who are able to catch a ball for the first time since they were diagnosed with Parkinson's. So real life-changing examples of immersive technology being used for patients as well. There have been 2 areas where there's new applications that are starting to emerge. So around remote monitoring, so using the technology, using things like eye tracking for attention deficits, for example, assisting those with disabilities outside of a care setting as well. So how can these technologies be used in that way? So there is a shift that is happening, and how that plays out over the next couple of years is going to be quite interesting to see. But ultimately, I think it comes back to what someone on the panel said earlier, which was, is it addressing a specific need? Is it helping address some of those challenges that people are actually facing within the healthcare space? Some of the other factors that have been really important are the political, socio-economic kind of factors. Funding for doing any research around this space has dropped massively. Yes, there are still funds out there, but actually that has had an impact in terms of healthcare providers having to really focus where the money is being invested and whether they can leverage any of that to carry out research using technology like immersive technology. And so costs have been a factor. Lack of evidence continues to be a factor, but hopefully the NHS is starting to change that. We've got some established frameworks to start standardising the evidence that's built in around this as well. I just wanted to share some of the challenges that come up time and time again, really specific to immersive tech. Some of this has been talked about earlier. I've already talked through some of the costs, but then there are business models with some of the solutions. The ongoing cost from licenses, this can be applicable to a lot of digital health apps as well. And it's something which the NHS struggles to kind of build into the business models and build into investment patterns within that as well. Education, not just for the people using the XR, but the staff as well. Myth busting, people think it's a gaming device, they still think it's a gaming device, but actually you can do so much more. And so the evidence that's being generated to show value around particular applications becomes really important as part of that education tool, not just for health professionals, but also for the public. Market, clear route to market, we've made a little bit of headway there. We've clarified some direct routes to market, which we're hoping to go live by the end of this year, and hopefully that will mean that it becomes a little bit easier for industries providing immersive technologies to actually break through the healthcare market a bit clearer. However, thinking back to some of those common themes around the metaverse, around interoperability, that's going to be a massive hurdle for the NHS to work through. It's based on lots of legacy systems. It's based on siloed systems. And yes, they're trying to talk to each other, but if we're imagining metaverses and, unprecedented interoperability, how is the healthcare system going to tackle that one? And what does that mean for patient data? The final one is around technical challenges. I know it's been around for decades, but there is not enough expertise in this area within healthcare. Yes, we can commission it, but actually, if you're going to embed it within pathways, within systems, you need that holistic understanding of all the systems, of all the data flows, of all the content, everything that wraps around it. And then thinking back to the other wider enabling technologies, there are big systematic kind of challenges across the NHS, and you can apply that across all of these enabling technologies that we're hoping to leverage to build this metaverse. The NHS is fragmented. Doing something in one trust is not going to be the same as doing something in another trust a couple of miles away. They operate differently. The NHS has a big issue around capacity and resource, and being able to test something like this is going to become tricky. Talked about education, but there is also a fear of change. There was a lot of change that happened in the pandemic. We could see it's possible. However, people have reverted back to old patterns and old ways. So how can you sustain the change and make sure that you were really benefiting from this type of technology? So last slide. Following on from some of the conversations in the panel, everything that's online, everything that you may have heard today, we know there's a long way to go. And so I've been optimistic here and said that we need to spend the next few years sort of learning more about things. Probably going to be more than a few years, to be honest. But we need to really understand where those opportunities are. What do they do to our services? How can we optimize them? Is it looking at individual technologies? I've just focused on immersive. What about AI? What about AI and immersive? AI immersive blockchain? You start combining this technology, and how can we actually use that and optimize it to really improve our national healthcare service? Naturally, there are risks, big safeguarding considerations when it comes to applying technologies like this in healthcare as well. All of these things that have an impact on policy and legislation as well. So there's a lot of questions there. And then the other thing is that the NHS is so used to investing money and investing time into long-term initiatives. But when tech is this fast changing, how can we mitigate that risk of early investment? So there's a lot of questions there still to unpack, still to unfold, still to work through. I'll leave it there. Thank you very much.